The Alliance recently began with the belief that we really could accomplish so much more if we worked together. And we are now a global health community here in the Bay Area of 50 members across the sectors. We have academic institutions, NGOs, tech, biotech, and other private sector companies in our network. We've gathered 3 of our wonderful members here today, Ideo.org, JSI, and Medicines 360 and their partners to share their experiences and learnings about human-centered design and its value in global health. The design thinking process really focuses on the end user and gets their voices at the table from the beginning and throughout the whole process, which is critical. This is important to sustainability, and it's also a great tool for democratizing global health and engaging youth. Joining us today is my co-moderator, Margot Funkenstock. I'm sorry, it's just too early in the morning. Funkenstock, and Vice President of Strategic Development at Medicines 360, who also was very instrumental in the founding of the HCD Exchange while at the Hewlett Foundation. I'd like to also introduce our speakers. We have Michelle Kruger, who's Managing Director of Ideo.org. We have Anne LaFond, the director of the JSI Center for Health Information, Monitoring and Evaluation. We have Maxi Guteau of the HCD Exchange, and we have Courtney Chang, Senior Program Lead at Ideo.org. Their full bios are on our website, and we are so pleased to have their expertise and experience with us today. I also want to thank Rithi Arun from Ideo.org, who was instrumental in this effort, and to Alliance's Program Fellow, Nicole Savage, who is providing tech support. So a few housekeeping things before I turn it over to Marco. Marco, we chose to make this a Zoom meeting rather than a webinar so that you all could connect with each other over chat. We suggest you rename yourself and add your organization to your name for better identification. We also ask that you stay mute and off camera while the speakers are speaking, but please put your questions in the chat. Nicole will be gathering them towards the end of the hour for the Q&A. And now over to Margot to kick off our conversation.
Thanks so much, Sarah, and thanks for having me as part of this conversation today. It's really exciting that the Alliance is spotlighting this work on human-centered design as it's applied to adolescent reproductive health. So we can trace the origins of the work that you'll hear about today back to 2013, when the Hewlett Foundation gave grants to Ideo.org, who you'll hear from in just a moment, and Marie Stopes to experiment together to use this approach of human-centered design to really improve the lives of adolescent girls. In this particular instance was in Zambia. And over the years, the Gates Foundation, the Children's Investment Fund Foundation, and USAID, who are all, as you know, large funders in global family planning, made their own investments in using human-centered design to improve adolescent reproductive health. What you're going to hear from today represents a really exciting evolution of all of that work. We have transitioned as a field from these one-off projects that really were matching designers and design firms and international NGOs for the most part, sometimes community-based organizations. But that evolution now has transformed into these 2 initiatives that are doing a much more inclusive process, bringing a lot more designers and young people into the process, and really trying to influence the broader field of reproductive health, and in fact, global health, using this approach called human-centered design. So we're very excited to share this work with you today, and just thanks to all the participants for making time for us. We're going to start today with Michelle Krieger from Ideo.org. Michelle's a managing director in the studio in California here. And Michelle, I think you're going to give us really a basic lesson on what it is, what is human-centered design, and really set the foundation for the discussion today. So I'll toss it over to you, Michelle. Thanks.
Awesome. Thank you, Margot, and thank you, Sarah, so much for bringing us all together. So we thought we would start today with just a couple minutes of an introduction to human-centered design. I know that many folks on this call are either practitioners or have worked in HCD projects, so this may be a refresher. But I'll share my screen and share a few slides, and then we'll open it up to a dialogue. Everyone see that? It's loading. Cool.
Yes, looks great.
Awesome, thanks. Okay, great. So a little intro to the process of HCD. So it's human-centered design is a creative approach to problem solving. And many of you may have seen this visual that we often use at ideo.org and in other forums to describe what this process is. While it looks like this, we like to say that often really feels more like this. It is inherently a creative process, and as a part of that, we encourage designers and the organizations with whom we're collaborating and co-designing with to really build empathy and follow where there may be energy or excitement as we are understanding the lives of people and seeking to design something that might meet their needs or improve their lives. So it's iterative, it's non-linear. It's kind of like composing music. Before you can play jazz, you need to learn the notes. So let's go into them real quick and talk about each of these three phases. So the first phase is inspiration. It's all about understanding people's needs and finding opportunities for design. So as designers, we like to say that we are looking during this phase for not just what people say, but also what they may be thinking, what they may be feeling, and what they may be doing. We all know as humans that often what we say is not what we may be feeling. And so part of the design process is really surfacing what are those underlying needs and observing behaviors that go beyond the spoken word. So user interviews is one of the methodologies that we use. Community co-design, so creating the conditions for our partners, our collaborators to co-create what might be alongside us. Expert interviews with folks who know this space, in this case the SRH space, to help inform and inspire and maybe create guardrails about what we may design together. And often we also look for analogous inspiration. What you're seeing on the screen here, this is a project that our sister organization, Ideo, ran, gosh, over 10 years ago now. And we were working with a hospital and looking at optimizing processes, roles during surgery. And for inspiration, we actually looked out to NASCAR, which if someone gets a flat tire in a NASCAR race, they can change the tire. I think it's in 3 seconds. It's quite amazing. And they do that with a cohort of like 20 people who come in, each have their own role, do it very quickly and efficiently, and boom, the driver's off and running again. So I think there's, we are often as designers looking out into the world for what might be analogous to the problems that we're exploring in our sector. And it helps us get out of ways of thinking that may feel comfortable and explore beyond. So as we move into ideation, ideation is all about imagining potential solutions, testing them rapidly with real people, and iterating until we get it right. So to begin in the ideation phase, we turn the challenges we've observed into questions so that they become opportunities for design. So this is an example from a project that we are currently working on around contact tracing, not for COVID, but for tuberculosis patients in Uganda. And what we heard there as a challenge is that the process there is that if a patient tests positive, then the next step is to get their household, their immediate contacts together under one roof for a visit from a health worker. And we heard that that can be challenging for a number of reasons. Folks are at work. There may be stigma or fear. It might be just logistically hard to all get into the same place. And so that challenge, one way that we might, in this project, that we reframe that as an opportunity is to consider how might we make a home visit so desirable that you really just don't want to miss it. So shifting from, gosh, this is hard, to how can we create the conditions that folks just really want to show up and be there. So it's just an example of how we turn a challenge into an opportunity, or how might we question. And then from there, we take that how might we question and we brainstorm potential solutions. So keeping in mind what we've learned about people's values, routines, and aspirations, both within the field that we're looking at, so within their sexual and reproductive health behaviors and values, but also outside of it, as we're considering how solutions might fit into people's lives. We quickly turn our ideas into prototypes, making concepts tangible so that we can learn what works. And really, you can prototype anything. Digital products, physical spaces, physical products, services and experiences, all sorts of things. And so once we sort of go through prototyping, then the next and final step in the initial design process is that we stitch together the learnings from the various prototypes that we've tried to design a cohesive product, service, or program. And so here, what we're looking at as we move into how might a solution be implemented is what sits at the intersection of what is desirable, so what people really want, and this is really the starting place, and also what is viable and feasible, both from a technological perspective, from a business perspective, from a cost perspective, and it's really the sweet spot in the middle that we are looking to design for as we go through this process. So that is a very brief primer on what we do as designers. I think today you're going to hear from two initiatives where we've applied the practices and principles of this work in new ways. And so I'll turn it over to you, Sarah, to introduce the rest of the speakers.
Yeah, thank you so much, Michelle. That was great. And now we're going to hear from Anne from JSI. She's done a lot of exciting work integrating measurement and into human-centered design. But Anne, before you start telling us a little bit more about JSI and the measuring and the process and outcomes of HCD, could you just tell us a little bit, as a large NGO, how did you come to human-centered design as an innovation for improving maternal health as well as reproductive health?
Thanks, Sarah, and thanks. Really happy to be here with everyone. As you know, JSI is a large research and technical assistance organization that works in the US and overseas in public health. And we were introduced to human-centered design about 8 years ago when we were asked to be an evaluation partner for a Gates Foundation project called Innovations for MNCH, which was implemented by Concern Worldwide. And in addition to doing the impact and program evaluation, we conducted 4 case studies to really understand how human-centered design was applied in these 4 projects and what could be learned from it, since this was a new area for global health practitioners. And that was our introduction, and it kind of it enticed us to be more engaged and to bring design into our work. So it started off as very much a new frontier for us. And over time, through collaboration, through research and programming together with designers, we've learned about how design can complement the work that we're doing, how sometimes it steps it up and makes it more effective, and also where it might not fit. And so it's been a learning, like any relationship, a learning process. And I can tell you that we're still on that journey, and we're still very excited to be integrating design into the work that we're doing. Some examples of projects where we brought in design. There's our projects that are focused on trying to understand the barriers to use of data at facility and management level in health systems. So we integrated human-centered design techniques to help frame the problem of data use from the user's standpoint, and then to co-create solutions for improving the use of data. So the real value for us is trying to dive deeply into who we're working with in a way that we don't always get the privilege to do when we design public health programs. Creating that, as Michelle spoke about, creating that empathy and understanding the problem from the perspective of people is really critical, and it gives us more space to do that design. It's also a process of solutioning, co-creating solutions. And so we've used human-centered design to, for example, to to try and understand better ways to introduce PrEP in Zambia for HIV prevention. We've looked at community health policy. So we've used design to bring stakeholders together to unpack the kind of barriers to a cohesive way of addressing community health issues in a country. So we've used it in many different settings, from the community level, service delivery level, to the policy level. And from our perspective, there's been quite a lot of openness in the organization to these new and more creative processes, but it has been sometimes a challenge to find a way to blend the two practices well. A lot of times public health practitioners will say, hey, we're already human-centered. What do you mean, right? So that's who we work with. We've used participatory methods before. This isn't something new for us. We do pilots. We test things ahead of time. And what we've learned over time is that these are all things that we are doing. A design brings in slightly different angles and ethos and tools and skills to be able to help us do these things in slightly different ways and often very more effective ways. Over time, we found that those differences and nuances can be managed and that it adds value to our work. We've also found ways to, I think, bring some of the processes of public health programming into the design practice. So the two disciplines are learning from each other, and really, I think over the last 8 to 10 years, finding some really good synergies and finding good ways to blend. One of the areas, as Sarah mentioned, that I've worked on is trying to understand how the two different disciplines measure or do evaluation or monitoring or learning. And we actually are studying that process in several different ways. We've created a website of 10 or 12 different cases called Measured Design that can help you understand a bit more about how measurement is integrated to design. And we're also trying to look at different kinds of practices, like integrating different kinds of metrics that are public health metrics and the way that design measures into practice. But we're still finding that there are differences in the way that we approach the use of measurement, which is so fundamental to public health. And one of them that I can explain really clearly is that design measures to learn, right? So it's a very solutioning process. It's more than just formative research that we would normally integrate into our practice. And the measurement is quick, it's using small samples, and it's actually creating solutions and testing them, and then when they don't work, fixing them, right? So there's a lot of iteration and learning, and we tend to wait to measure in the work that we do in public health to understand what's worked and why, maybe retrospectively, maybe while we're implementing, but more in a more kind of systematic and rigorous way. So in reality, there has been tension between the value and the rigor of design measurement versus public health measurement. But if you understand the different focus and the different purpose of how measurement is used, you'll find that they both are bringing something very effective to the practice. I think one of the most valuable lessons that we've learned is that as designers and health practitioners work together, that any of the kind of tensions and differences that are there are actually being worked out in practice as they integrate their teams more effectively. And we have had experience where design has been brought in the beginning and stopped, and then the implementers took over. But where things have been most effective is when the design team and the public health team stay together throughout the process to try and integrate some of the ethos of design around iteration and learning and human-centeredness, and some of the years and decades of experience of public health and public health learning and rigor that goes with the practice. So back to you, Sarah. Thank you.
Thanks, Anne. I'm actually going to take over here. And as you're talking, I'm reflecting on those of us who've been doing this work for a while, and those of you listening today who have experience in implementing or using this different approach of design thinking and human-centered design in a space like global health. We have learned a lot over the years, and as Anne just pointed out in the measurement example, the two cultures, in fact, of these two disciplines can often come at things in very different ways. And so a designer, as Michelle described, takes sort of a blue sky approach and says, well, how might we solve this problem? Whereas I think in public health, those of us who have been doing this for our careers we tend to start with a log frame or a plan, a work plan at least, of how you're going to solve the problem. So one of the reasons for creating the HCD Exchange, which you'll hear about from Maxie in just a moment, was almost as a support group for those people who had been curious about the combination of these two disciplines, but really had to navigate all of these tensions in both implementing projects differently, measuring their impact. There was a lot of things that really needed a more safe space, if you will, to talk about things. So the origin of the HCD Exchange was both a combination of a support group, but also a real robust learning platform. And so I'm going to toss it to you, Maxie. Maxie is sitting in Nairobi today, leading the HCD Exchange. We're so excited to have you. Thank you for taking time. And maybe, Maxie, before you tell us about the Exchange, you and I met several years ago when you were in a different role in learning about this work. And I'm just curious to hear from you. What first kind of intrigued you about this approach of using design in AYSRH? And then tell us, please, about the Exchange.
Thank you so much, Margot, and also for the work that you did in shaping, the origins of the HCD Exchange when you were back at Hewlett, and also what you continue to do, including facilitating this conversation today. I got into, I won't even call it human-centered design, just design thinking way back like in 2007 when, while working with a behavior change program in high schools, universities, and out of school youth on a USAID grant. And I got introduced to design thinking then as a way to work with adolescents and young people and harvest and build on their insights to define the sexual and reproductive health and related challenges and test some potential solutions with them away from the then traditional abstinence, being faithful, and condom use approach. And that at the time, it completely changed my perspectives on, meeting sexual reproductive health needs for young people. And I particularly was amazed by, how we were able to shift some of the program targets and even outputs and cause them to be entirely different while shaped with by young people as opposed to just by funders and program implementers. And realizing for me that it was that how exciting that was, to not only design around and with the user. I then built, my next couple of years of work with the same ethos, first working with young people to define and shape a program we called One-to-One, that was an integrated digital platform, some work with the innovation and adolescents team at UNICEF to end adolescent AIDS, and where we met working with SIF at the time as a program manager for some investments around human-centered design and sexual reproductive health, one of which actually is, HCD Exchange, which, as you mentioned earlier, when we met back in Dar es Salaam in 2018, and at the time, we're bringing together some siloed, sporadic and scattered design-led sexual health projects, programs, and initiatives. But that particular forum, with 60 of us, we made some connections, we built some shared assets and set the foundations for this, what is now a community of practice. And a year ago now, meeting with a couple of the people who are here, some from JSI in Supply, Ideo, Billion Girls Collab, who we've partnered with ever since then on Voice Up that you'll be hearing about later, Design for Health, that's doing, this kind of design thinking HCD for the global health, Hewlett Foundation, SIF, and Bill and Melinda Gates and USA. We started the second phase of HCD Exchange. And our idea since then has been to sort of accelerate the development of this field as a robust and very transparent and efficient open space for learning and for connection. And we understand that, human-centered design, as it were, can really totally strengthen strategies on sexual health, interventions on youth participation, policies that can help and involve and reach more and more young people with appropriate and practical solutions around their sexuality. And part of what we are working on now is growing this stronger connections and learning around a lot of the actors, around designers, practitioners on sexual health, evaluators, as Anne spoke about earlier, and also young people themselves. And some things we are sure about is that we need, to enable for there to be a lot more accessible and reliable practices on HCD and AYSRH. and also, that are more spread across geographies, across institutions. And then just the same way M&D is now totally institutionalized in our program thinking, and funders expect it, and program implementers use it as a way of work. We do hope that in some day in the future, as we continue to co-create evidence, HCD can be one of those things that is institutionalized and mainstreamed completely, and obviously ensuring also meaningful youth engagement. So having said that, our focus primarily is now on creating learning mechanisms and generating this robust evidence based on how to apply human-centered design in this small global health or public health field that we call adolescent sexual reproductive health. And we are activating this through the community of practice that I mentioned about, and based on a HCD lens that helped us get an understanding of all these players that we call actors in the field, what their individual goals, their struggles for design, their needs, their aspirations, their learning questions are. We developed a learning agenda that focused on two broad learning areas. One, how can we ensure there is more learning about HCD and AYSRH in theory and in practice? Asking questions like, how does HCD work? How is it evolving? How does HCD work in the context of AYSRH? What's the influence of HCD and AYSRH? And then secondly, learning about how to do HCD and AYSRH even better. And here is where we are talking about the kind of collaboration and tools and communication and capacity building and even communicating and having some sort of nomenclature that is standardized around it. And we have 4 sort of broad learning topics that we are focusing on right now, one of which is adolescent insights on HCD and AYSRH, just how we can mine and seed those out properly. And then the second aspect, which is really important, is on youth integration in HCD and AYSRH, ensuring that young people are meaningfully involved and integrated in the process of design for sexual health. And then the quality and standards on HCD and AYSRH, what are those? Speaking of standardizing those or just leaving it open as a field continues to grow. And then finally, as Anne spoke about earlier, it's the whole question on measurement and evaluation in HCD and AYSRH. And the tensions that arise from those two are very many. So I will end just by saying, to get ahead in seeking answers under these topics, we are definitely curating a lot of existing experiences from those ones who have been around for long. We are synthesizing that experience. We are generating new learning and evidence through working groups, and trying also to model a way of working where we build trust around learning and exchanging of each other's knowledge and experience. And we are, I think Liz in the chat earlier on shared, how you can join and be part of the HCD community of practice. So back to you, Sarah. Thank you very much.
Thank you, Maxi. That was fascinating. And it was really wonderful to see what a journey you have taken with HCD and the exchange, as Margot had talked about, kind of having it from, really starting as a support group for people who are new in this, and really how you've accelerated the field, accelerated and improved, and how it's really involved. It's really also fascinating for me how important, trust is something that I really picked up on, how important that building that trust is, and the integration of youth and how important that is. And that brings us to our next speaker. We have Courtney and Michelle, both from Ideo, and they're going to tell us about the Billion Girl Collab. It's an initiative of Ideo.org, and it's described on their website as an incubator for girl-led solutions. Michelle, it was great hearing kind of a little bit of the genesis of Ideo.org in global health, but if you could tell us a little bit more, and also really why you started and the genesis of the Billion Girl Collab Both of those would be really fascinating to hear.
Thank you, Sarah. Yeah, I'm happy to share on both of those fronts. Just a little bit of background on Ideo.org. We are a nonprofit organization that spun out of the global design and innovation firm Ideo 10 years ago now. And our sort of spin out was to have a specific mandate on applying design practices and principles to challenges in the social sector. And so one of the largest portfolios that we have at Ideo.org is focused on sexual reproductive health and rights. And much of that work has been focused in sub-Saharan Africa. We have a studio in Nairobi. And our colleague Larissa was going to join us today from Nairobi and had a family health emergency come up, so she wasn't able to be here. We're super grateful, Courtney, for you jumping in and filling in for Larissa. So let's see, just background on the Billion Girls Collab and our SRH portfolio. This work really started in collaboration with Margot and the Hewlett Foundation, where we got inspired and curious around how we might consider applying design to an area where at that time there had been less resourcing and sort of innovation around different programmatic interventions for adolescent girls specifically in managing their sexual and reproductive health and the decisions around that. And so what we did with initial funding from the Hewlett Foundation is we teamed up with Marie Stopes, this is in Kenya, to co-create a solution that might integrate into their activities and portfolios of work. It was a solution that was both service design insofar as it was around how does a young person navigate to and experience accessing sexual and reproductive health services. It was also a brand, which is called the Divas, where it was a kind of a way for young people to see themselves in characters that embody different contraceptive methods. So we had the Supergirl for I think this, yeah, it was for the IUD. So she's protected for 10 years. She's a Supergirl, different characters to embody different methods. And so really what we did there was take the creative process that I described earlier and apply it to the sticky challenge of how do we get young people to access and stay on contraceptive methods as long as they are not wanting to have a pregnancy. From there, our portfolio kind of rippled out, and in collaboration with PSI, MSI, DKT, and others, we almost replicated this process in, gosh, I think it ended up being 16 or 17 different projects in over a dozen countries. So really joyful to go on that journey of working with so many partners. Shout out to Rosalind from MSI. I know you're on this call. I hope there are others to really co-create solutions for young people. As we took a moment at the end of 2019, 2020 to kind of step back and reflect on where we wanted to take this portfolio, I think we had a couple of realizations. One is that while we have co-created many solutions that are impacting girls out in the world, it did sort of start to feel like we were doing the same project over and over again, and that we weren't reaching sort of economies of scale around that, and that it is probably not, it didn't make sense to us to continue working in this way of one partner and Ideo.org and a funder kind of collaborating on a solution in one location. It felt like there was sort of limitations there around the scale and reach of this work. And we were also really inspired to push further and go deeper in how we engage young people in co-creating this work with us. It is inherent in the design process to work with users, to hear their stories and experiences. And we felt and continue to feel inspired around how we might push that further and engage girls, not to build empathy for their experience, but actually to shift power and give them the agency to make decisions about where resourcing is going, and also what the solutions that might impact their lives look like. And so with that, we sort of birthed the Billion Girls Collab, and I'll turn it over to Courtney to share a little bit more about that and what we're doing today.
Thank you, Michelle. And yes, I'm filling in for my colleague Larissa Baccia, who is out of our Nairobi studio and leading this program, but unfortunately couldn't be with us today. So please accept my substitution. The Billion Girls Collab, as Michelle said and alluded to, is really underpinned by 3 core beliefs now. One, that HCD is that tool that is excellent for facilitating collaboration across different organizations, as well as this power shifting, putting girls at the center of the design process. The second is that we do believe girls have the power to imagine the future they want to see. And it's our role as designers in a design organization to adapt our tools, our methods, and create the spaces that allow them to express themselves. So for that particular pillar, I'll talk later about our Girl Fellowship now. And then last, a core belief is around that grassroots organizations and movements are the ones most connected to girls, yet are often overlooked by larger funders or partners. And so it's a big belief under the Billion Girls Collab that we want to put the bigger might, the might of bigger funders and institutions behind amplifying these grassroots efforts. So I'll also touch on an innovation fund that we've started to engage and award grassroots organizations working with girl-led approaches. So 2 of our really exciting activities in the past couple months have been doing 2 design sprints and launching a fellowship out of Nairobi. You know, and I think a lot of learnings already have come out of doing this and about what does collaborative work across partners look like in design and innovation, as well as what does it look like to truly try and shift power and decision making to girls themselves in program design and intervention design. So first, speaking about a design sprint that we co-hosted with the HCD Exchange back in April in response to COVID's impact on adolescents. That sprint resulted in a solution called Voice Up, which we'll post the link in the chat. It's a resource for organizations working and serving adolescents to provide information on self-care that was really co-developed with young people. This was an incredible learning opportunity because it was, you know, a month after we were all thrust into working remotely. And so really having to figure out, how does this process translate to the remote world? We worked with 3 partners as well as HCD Exchange. Most of the teams were based in Kenya, and it was a 3-week online virtual sprint. And one really interesting learning for us was that working in this remote world actually really broke down old power dynamics that we might have held in person, where, you know, a CEO of Ideo.org is just a little square on the screen as much and taking up the same, or hopefully if facilitated right, less space than an adolescent girl who was brought to the table to share her contributions and ideas as well. So that was a really heartening and exciting actually move for us to be able to learn how to facilitate those conversations in a way that balanced power dynamics a bit more. The second key learning, you know, in our second design sprint, which just wrapped a couple weeks ago, was learning how rallying behind girls was actually a unifying goal for all of us and made collaboration across partners a lot easier. So when the different partners heard that the design brief that was brought to the table for our January sprint was developed and ideated by girls themselves, and that brief was, how do we engage parents in this puberty conversation with adolescents early on? That kind of, you know, endorsement by girls and selection by girls was kind of added to the sense of urgency and collective action that all the partners had towards designing for that engagement and the enthusiasm we all had, in a way that had we all come to the table with our organizational goals or priorities might not have been the case in a unifying rallying call for us all. So that continued to happen, you know, when the girls in the middle of that January sprint were surfacing ideas, were voting on the ideas that they thought would work best for them and their peers. it added that layer of confidence to all those partners in continuing to put effort and resources towards building this. A third learning, I think, from our design sprints is that openness and sharing really brings more people to the table in big and small ways. So our funders over the past year of the Billion Girls Collab initiative have certainly been a big proponent of making all outputs and learnings available to the sector, open source to the sector, but also seeing that that was a really attractive hook to continue partnershiping with different partners around the world, that even if they couldn't participate in that first design sprint, for example, they really wanted to stay engaged to hear what those outcomes were and what the learnings were about working remotely or working with girls or working on self-care. And that led to, one of the partners who couldn't make it for the first time then being engaged in a full-time partner in the second design sprint. So really seeing that kind of that openness and sharing really keeps people engaged and in a collaborative spirit with each other. The last key activity I wanted to share more about was a key part of our activity this year was launching a girl fellowship, and that's been established to bring on 3 to 5 girls ages 19 to 22 from different parts of Kenya, as paid design team members who join the team on a weekly basis to help conduct peer-led research, to share back insights with the design team and with the partners, to voice important issues, to surface the design briefs that they would like to see worked on most, to surface the prototypes that they want to see prioritized and funded and worked on, and ultimately to identify winning concepts and partners. And so it was really exciting to see in this last design sprint that play out end to end, with having those girls define that design brief, define the 2 prototypes that got pushed the furthest, and even the final, organizations that were working to get these ideas implemented. Each had one of these girls on their team as an ambassador to the work and to the work plan moving forward. So all that to say, so many learnings from the past couple months of activities under the Billion Girls Collab. And so would love to share more if there's any more questions, but I'll wrap it right there for now. Back to you.
Thanks, Courtney. I'm just going to ask you one more question while we have you. Thank you again for jumping in today. I think it shows, I was thinking about this, I think it shows the flexibility of designers, that you're able to just come in and take this on today. It looks like you might be still muted, but what I was going to ask Courtney, and maybe I'll just toss this question out to the panel, for people in this conversation today who are really interested and curious in taking on a joint collaboration process or a joint innovation process like the Billion Girls Collab or like the HCD Exchange. Courtney, I know you thought a lot about this at the beginning. You were instrumental in creating and launching the Billion Girls Collab. What advice would you have for this group about things to consider early on in terms of bringing together this multiple set of different partners? Courtney, are you able to jump in? I don't know if can you unmute yourself?
Sorry, I think I cut out for part of the question.
So the question really was about just advice for people wanting to create a joint collaboration process. I know you thought a lot about this in the creation of the Billion Girls Collab. So thanks again. I also was just thanks to you for jumping in today. Really appreciate it.
No problem. Thank you. Yeah, I think 2 big reflections and learnings in doing this process. The first is really having to get pinpoint definition on our goal. So was our goal with the Billion Girls Collab and with a collaborative approach in service of getting better solutions? Was it in service of getting more solutions to scale? Was it in service of building capacity of more organizations? And I think defining that goal first would have steered us towards different partnership and operating models of how we do this work. So that's the first thing I'd flag. And the second thing is, we did encounter in our first sprint and some of our early activities with a lot of collaboration there, we risked having a lack of ownership and a kind of a leadership vacuum in key decisions. So we kind of in the first sprint sat back and hoped that the partners would just give us a good steer on what they wanted to learn and what was going to be the best solution. But we quickly learned that without kind of more stakes in the game, that everyone was kind of not prepared or ready to take full ownership over the solution in the end. And so since then, we've pivoted our approach a bit to really find ways to engage people more meaningfully and have them see how they could play a role in implementation of solutions as an outcome. Hence the establishment of an innovation fund as well, where partners have an opportunity to access funds and additional design support if they are committed to taking these ideas forward. But I think lastly, also something that we're honestly working on still and want to be transparent about is that in this collaborative space where there's a lot of decision makers and voices, we as a facilitator are still holding some of the power of deciding, of moving things forward, of selecting which partners or even which girls get chosen to participate in the program. And so we're still in the process of kind of working that out and figuring out what our role and what in that space should and shouldn't be.
Thank you so much, Courtney. And really, I agree with Margot. Thank you so much for coming in at the last minute and joining us with what has been a fascinating discussion. One of the things that I thought was really interesting that you brought up was how working remotely and in this pandemic really kind of busted and really broke down some of the old power dynamics. When we started this conversation, we talked about how design thinking and human-centered design can really be a tool for the democratization of global health. And I have one question. We have lots of questions from our audience, and we'll get to those, but I wanted to toss one question, the first question, back to Maxie, and just ask, how do you see design as a form of decolonization of global health, and how can we accelerate that?
Thank you, Sarah. That's a loaded question. And I think the broader design field is still trying to figure that out. But certainly one of the things that I can share, maybe just from experience of HCD Exchange very briefly, is that, from onset, from 2018 up until, where we are right now, we've seen that, we try and apply design and HCD to bring a community of practice around the same field of HCD and AYSRH together. But we've seen that there are things that are important when you are wearing the decolonizing hat. There are things that are important to set as necessary grounding for the success of where we head up. And those three things are, when we are thinking about democracy, and that is about having many more diverse voices represented in the entire HCD process, be it in sexual health, be it in global health, just ensuring that it is not leaving out anyone, and there's a lot of participation for everyone. The second one is about mutualization, and this is about creating a sense of shared ownership and reducing that elitism in the practice of HCD, ensuring that it's not just for a select few, and especially maybe not just for a select few somewhere else. And then lastly, it's about localization. And I think in previous conversations we were having, there is who actually sets, and this is a question that Courtney has asked, who is actually setting the agenda, and ensuring that often we are leaving that to be as relevant to the different people, to the different contexts, to the different geographies, but most importantly to the person that is affected the most. And often those are, in different places where the resource is not there, in different resource constrained environments, often in the global south, often in sub-Saharan Africa, often in South Asia, often in remote places of that nature. So that's the thought I would just love to posit at this stage. Back to you for continuation.
Thanks, Magda. You're going to toss it to me. We have a question that came in that I think is really interesting, and I hope, Anne, you don't mind. I'm going to ask this of you. And that is, how do you get the buy-in of researchers, particularly in global health, as we've talked about, to really understand the value of HCD? I described earlier my experience of seeing a lot of skepticism around, why aren't we doing what the evidence tells us to do, and isn't that enough to help us design the right program? So curious, Anne, I know you've thought a lot about this, how you think about that buy-in process, and if you have any advice for this group.
Yeah, it's a good question, and I think that first you have to think about how public health is built on this whole foundation of evidence and experience and past and science and what we know, and design isn't asking us to throw that out the window. That would be foolish. And design brings in content matter experts and different viewpoints to the process. I think what they're asking us to do is to start first and foremost with that kind of desirability lens, and really use that as a very strong guide to get us to a solution, to interventions that we can then take and implement and use measurement as we've done in the past to test and learn about how they work and adapt them, and then evaluate them to look for attribution. So I think it isn't, I think what I would encourage people to do is to not think of it as an either or experience, and that that we're bringing in these two different ways of approaching work, and where design is orienting us to be very human-centered in ways that I think we aspire to. I mean, if you came into public health at any time during the primary healthcare early era, it was really integrating people and people's desires and their agency into public health. And through our progress and focus on different areas of public health programming, system strengthening, et cetera, we sometimes lose a vision of how people can be really in charge of creating health and health outcomes and being part of the solution themselves. So I think design is reminding us that we might need to step back and start exploring and gaining that empathy and using those techniques. It doesn't say to abandon, what we've done in the past in terms of good public health practice. I also think from the standpoint of public health practitioners, we can be helpful in bringing some of our measurement techniques into design. We use theories of change to try and understand and ground us about these pathways of change that are really important for directing and testing our work. And if we can encourage our design colleagues to think about that pathway, not just from designing those very useful solutions, but how that solution will then be implemented over time to create the service or the system or the health outcomes that we desire. And using some of those outcome metrics in their thinking when they're creating design solutions, it does bring the practices together in a much closer way. And while their metrics may be more human-centered and focus on creating a delightful, desirable, compelling service for an end user, we also want that service to be implemented effectively so it leads to that health outcome that we're looking at. So again, the buy-in really is, I think, coming with respect for each other's purpose and disciplines and finding a way to bring them together.
Thank you, Anne. That was great. We have another question, and we are coming up towards the end of the hour, but I'm so glad there's so much interest in this, and we can think about another session. But the last question I'd like to put out there today is, and I think, Michelle, you would be great for this one. It comes from Dipushu from the School of Visual Arts, and they're wondering, I often think about ethical practice to follow while working with people and communities. What are some of the resources that you'd like to recommend for a deeper dive on this topic? Michelle, could you take that one?
Sure, thanks, Sarah. There's a lot out there that I would encourage this group to explore. Ideo.org has ethical practices and guidelines, some of which we highlight on our website. Design for Health is an initiative of this broader community that has been championed by the Gates Foundation, the USAID, and there are working groups and efforts specifically focused on what do ethical best practices look like at the intersection of design and global health. Maxie, I think you can comment on whether there are groups within the HCD Exchange. I imagine there are that are specifically focused around this. So a lot in terms of what are best practices. I think as designers, part of our role and accountability is to also set agreements and co-create with the users that we're working with and our partners. What are, how are we going to approach design work? What are the ways that we're going to bring in voices, particularly voices that historically have less power? And I see our role as designers in really amplifying and creating the space for those voices as opposed to representing them directly. So there are links being shared in the chat right now, specifically on this question of ethics. And we've done a lot of work in thinking on it, as well as I know everyone else on this call has as well.
Great. Okay, technical difficulties. Thanks, Michelle. That was a really important question to end on. And Anne has just shared another resource, which is a guide that was prepared under the Adolescence 360 project, which has been a very another cornerstone project in this space. So I think, Sarah, I'll toss it back to you. We're so excited that there was so much interest in this topic today. I think we've been able to represent a breadth of the work that's been done specifically around adolescents using design thinking in HCD. We know that there is broader interest in global health. And as Sarah said, I think it'd be great if there are ideas for what another session should cover. Sarah, over to you.
Yeah, well, thank you. I have to thank our speakers and my wonderful co-host this today of Margot. This was great. And we'll put more resources on our website. I think I have all of your email addresses for the registration, and I'll email you those, but it's bayareaglobalhealth.org, and then you can go to events and then find this one. But we'll put some of these great resources that were here, and we can also think about, reach out to us and let us know if you want to have more on this subject. We can consider design sprints or just kind of a part 2 to this, because there were so many wonderful questions that we didn't even get to. So I want to thank you again to our speakers and our wonderful members for joining us today, and for all of you participating with us. I know for some of you it's very late in the evening, and for some of us it's fairly early. So wishing you all well, and thank you again.